Okay, welcome back. In this video, we'll continue our video series on pharmacology, and we will discuss chapter number 14, Endocrine Drugs. The learning objectives for this chapter: compare and contrast the causes and treatments of diabetes mellitus type 1 and type 2, differentiate between the therapeutic effects of insulin and those of other categories of oral antidiabetic drugs, name drugs used to treat hyperthyroidism and hypothyroidism, compare and contrast the therapeutic effects of drugs used to treat diseases caused by hypersecretion and hyposecretion of hormones of the pituitary gland, differentiate between the therapeutic effects of corticosteroids versus anabolic steroid drugs. When given the name of a well-known endocrine generic drug, identify the trade name. When given the generic and trade names of an endocrine drug, identify what drug category it belongs to and what disease it's used to treat. When given a drug category, identify several generic or trade name endocrine drugs that fall in that category. And when given an ending common to several generic drugs, identify the related drug category. I will start off with a brief introduction on the endocrine system. Now, the system consists of many glands that will secrete hormones into the blood. Now, when these glands malfunction, they either secrete a decreased amount of hormone or an increased amount of hormone into the blood. In this illustration, we have some examples of some endocrine glands. Starting up here in the brain, we have the pineal gland and hypothalamus, pituitary gland here, thyroid and parathyroid here, thymus, adrenals, pancreas. For females, the ovaries, and for males, the testes. First, we'll talk about insulin drugs that are used to treat diabetes mellitus. Now, insulin is secreted by the beta cells of the islets of Langerhans within the pancreas. Now, insulin, of course, plays an essential role in the glucose metabolism, and it works by lowering blood glucose levels by helping cells utilize glucose. Some basic functions of insulin: it transports glucose to the cell, then it will bind with an insulin receptor that are found on the cell membrane. It will help transport glucose inside of the cell to be utilized, and then from there, the glucose is metabolized to provide that cell with energy. So if insulin isn't there, glucose can't be utilized by the cell. Now we'll talk about diabetes mellitus. This is a disease of the pancreas and of the body cells, and there are two types. For type 1, this is where the pancreas does not produce any insulin at all, and in this situation, the person would have to inject insulin on a daily basis. Type 2 diabetes, this is where the pancreas produces too little insulin, or you have the number of insulin receptors or their sensitivity to insulin is decreased. Type 1 diabetes mellitus, this is previously known as IDDM, insulin-dependent diabetes mellitus, or also juvenile onset diabetes mellitus. And this is treated with a subcutaneously injected insulin every single day. For type 2 diabetes mellitus, it is formerly known as NIDDM, non-insulin dependent diabetes mellitus, or adult onset diabetes mellitus. And these are treated with antidiabetic drugs, and insulin may be needed. It just depends on how bad off that person is. Now, a diet with controlled amounts of calories from carbohydrates and fats in combination with weight control and exercise are also very important components of managing both type 1 and type 2 types of diabetes mellitus. Now, untreated or uncontrolled diabetes mellitus results in consistently elevated blood glucose level. This will eventually lead to complications of diabetes, which include diabetic retinopathy or diabetic neuropathy. It could also lead to arteriosclerosis, ketoacidosis, and eventually death. So when it comes to levels of blood glucose, this is not something that should be played around with. It's something that should be monitored very closely and controlled very closely. In this table, we have a side-by-side comparison of type 1 and type 2 diabetes mellitus, the former names that each one is known by, the approximate time when they develop. For type 1, childhood or young adulthood. For type 2, middle age. See some contributing factors for each one, and treatment options for each one. Now I'll mention a few historical notes. The word insulin is derived from the Latin word insula, which means island, which is a reference to the islets of Langerhans, where the hormone is actually produced naturally. Before the discovery of the drug insulin, diabetic patients were kept on extremely low-calorie diets, often to the point of starvation, as this was the only known treatment to keep the blood glucose levels within a normal range. Now, the drug insulin was first isolated in the 1920s, and the first insulin was extracted from ground-up pancreases of cows and pigs, and the injected liquid was thick and a muddy brown due to various impurities Later on, insulin was purified and refined, and a standardized measurement, known as the unit, was adopted for insulin doses. Now, new insulin drugs have been created using recombinant DNA technology. Now, this technology inserts the gene for human insulin into a yeast or a bacterium, which then multiply rapidly and produce large amounts of insulin drug. Other insulin drugs created by recombinant DNA technology include insulin analog drugs. An analog drug is structurally similar to the original molecule, but is not entirely the same. Humulin insulin was the first recombinant DNA drug of any type to be marketed. Insulin aspart was the first insulin analog drug to be approved by the FDA back in 1986. And in 2006, the FDA approved Exubera, which was the first powdered insulin that could be inhaled instead of injected. All right, now I'll talk a little bit more in depth about insulin. A molecule of human insulin consists of an A and a B chain of amino acids. When analog insulin drugs are created, one or more of the amino acids in the human insulin molecule is changed. In the analog insulin drug named insulin aspart, aspartic acid is inserted at site B28 on the B chain. In insulin glulisine, glutamic acid and lysine are substituted. In insulin lispro, the amino acids lysine and proline are reversed at sites B28 and B29. In insulin glargine, the amino acids glycine and arginine are substituted. And you'll find that some of the trade names of analog insulin drugs, Humalog, Novolog, contain part of the word analog to indicate how the drug was created. Right, so going back to insulin drugs that treat diabetes mellitus, all insulin drugs are grouped according to a few characteristics. How quickly they act in the body to lower blood glucose. This is based on the size of the insulin crystal. The amount of hours their therapeutic effect will continue. And this is dependent on the amount of protamine and zinc that's added to insulin. Insulin drug groups include rapid-acting insulin, intermediate-acting insulin, and long-acting insulin. When it comes to rapid-acting insulin drugs, these are taken in the morning or right before eating. And the onset of their therapeutic effect is almost immediate. It can actually begin to lower blood glucose levels in as little as 15 minutes. And their therapeutic effect can last anywhere from 2 to 12 hours. This is also known as regular insulin, and is sometimes indicated in the drug's trade name by the abbreviation R for regular. See, there are 3 different types of rapid-acting insulin. You have a type that's derived from the pancreas of a pig. An example of this would be regular Elitin 2. Another type is created by recombinant DNA technology, such as Humulin R or Novolin R. And the third type is insulin analog drugs created by recombinant DNA technology, such as the 3 we talked about a few minutes ago: insulin aspart or Novolog, insulin glulisine, also known by the trade name Apidra, and insulin lispro, also known by the trade name Humalog. Alright, this image we have an example of a packaging of Humulin. Next to the name you see the big capital R, which means it's a rapid-acting or the regular type of insulin. When it comes to intermediate-acting insulin drugs, these have a slower onset but have a longer effect than rapid-acting insulin drugs. See, when it comes to their onset, it's usually within 1 to 2 hours, but their therapeutic effect can last for 24 hours. And there are 2 types of intermediate-acting insulin drugs. You have those with an added protamine and zinc. They're added to prolong the therapeutic effect of insulin. And those with a different size of insulin crystals. And the size difference is to slow down the onset of action. And there are some different types of intermediate drugs that are produced. And the acronym NPH insulin, also known as INN, isophane insulin, which is another term to represent intermediate acting insulin. And there are different kinds of this type of drug. One type is those that are produced by recombinant DNA technology, such as Humulin N or Novolin N. And the fact that it is a intermediate acting insulin drug is indicated by the N after the trade name. Another type of intermediate acting drug would be those derived from the pancreas of a pig. An example of this would be Lente Elitin 2. Right, when it comes to long-acting insulin drugs, these have very large insulin crystals that contain an added amount of zinc to them. Now, these do not begin to lower the blood sugar levels for over an hour, and their therapeutic effect lasts for a full 24 hours after just 1 dose. And long-acting insulin drugs are also known as ultra-lente insulin. Some examples of this type of drug would be insulin detamir, known by the trade name Levemir, and insulin glargine, which is known by the trade name Lantus. You can also have combination insulin drugs. These may contain a mixture of intermediate-acting insulin drugs, such as NPH insulin or an insulin analog, or it could be a rapid-acting insulin, such as regular insulin or an insulin analog. And when it comes to the combination insulin drugs, the percentage of the intermediate-acting insulin drug is always listed first. Now, for example, in the drug Humalog Mix 75/25, of that dosage, 75% of that would be the intermediate-acting drug of that combination. You also have other examples listed here: Humalog Mix 50/50, Humulin 50/50, Humulin 70/30, Novolin 70/30, and Novolog Mix 70/30. All right, in this image we have an example of a packaging for Humulin combination drug. This would be Humulin 70/30. So this mixture would be 70% intermediate-acting insulin, and then 30% would be the fast-acting regular insulin. Now, because the insulin molecule is broken down by digestive enzymes, insulin can never be given orally. Now, patients with type 1 diabetes mellitus inject insulin subcutaneously once or sometimes several times a day at various sites on the upper arms and the thighs or the abdomen where there is subcutaneous fat. Now, for patients who need to take insulin injections, they need to use a special insulin syringe. Now, these are only used to administer insulin drugs. They can never be used for any other type of liquid drug. That's because the calibrations on the side of the syringe are in units, which are used to measure insulin. You also use a insulin injector device, which will be supplied by the drug company, and these are already pre-filled with insulin, so nothing has to be measured. It's already ready for the patient. All right, in this image we have an example of a insulin syringe. You can tell the very large numbers that indicate the number of units of insulin. Again, this is only used for administering insulin. It cannot be used for any other type of liquid drug. In this image we have an example of a Humalog quick pen. This is roughly the size of a large writing pen, and it's already preloaded with insulin. So this would be an insulin injector device. Another way you could administer insulin would be through an insulin pump. These would administer insulin directly into the blood, and the tubing is connected to a portable insulin pump, usually worn on the patient's belt or carried in a pocket. Now, for patients that have very poorly controlled diabetes, another option is having an implantable computerized pump. This is inserted into the abdomen of the patient, and the patient programs insulin dosage via a remote control. All right, now we'll talk about oral antidiabetic drugs. When it comes to type 2 diabetes mellitus, the pancreas still makes insulin, but at smaller amounts than normal. Or there could be a situation where the body is resistant to allowing the insulin as produced from entering the cells. Now, it may be sufficient enough to keep the levels of blood glucose within the normal range, with some controls on the patient's diet and exercise and weight loss. Now, if this can't be controlled through those steps, then an oral anti-diabetic drug may be prescribed. Now, oral anti-diabetic drugs are not insulin, and they're not effective in treating type 1 diabetes mellitus. Now, these kinds of drugs act by stimulating the beta cells of the pancreas to produce more insulin, or they can also act by increasing the number of insulin receptors so that cells are not resistant to the effects of insulin. One example of an oral antidiabetic drug would be the sulfonylurea drugs. This was the first type of an oral antidiabetic drug that was developed. Now, structurally, this is derived from an anti-infective sulfonamide drugs, but they do not have an anti-infective action. And these work because they stimulate the beta cells to produce more insulin. And the first generation of this kind of drug began production in the 1950s, and all of their generic names all end with the suffix amide. The second generation of these drugs were introduced in the early 1970s, and all of their generic drug names end with the suffix ide, IDE. See some examples of sulfonylurea oral antibiotic drugs: chloropropamide, also known by the trade name Diabenese; glimepiride, also known by its trade name Amaryl; glipizide, known by the trade names Glucotrol or Glucotrol XL; glyburide, known by the trade names Micronase and Diabeta; tolazamide, and also tolbutamide, known by the trade name Oronase. The other type of oral antidiabetic medication are the meglitinides. And these act by stimulating the beta cells of the pancreas to produce more insulin. Some examples of this class of drug would be the teglinide, also known by the trade name Starlix, and repaglinide, also known by the trade name Prandin. Another type of oral antidiabetic drug include the thiazolidinedione. antidiabetic drugs. And these maintain a normal level of blood glucose without actually increasing insulin production. How they do act is they increase the sensitivity of the cell to any insulin produced by the pancreas. They also act by suppressing the release of stored glucose from the liver. Some examples of this class of drug would be pioglitazone, sold under the trade name Actos, rosiglitazone, sold under the trade name Avantia. See, another class of oral antidiabetic drugs, alpha-glucosidase antidiabetic drugs. And these work because they inhibit the action of certain enzymes that digest carbohydrates. And these enzymes would include amylase from the pancreas and also alpha-glucoside hydrolase from the small intestine. And by doing so, less glucose will enter the blood. So if there's less glucose in the blood, the pancreas does not produce as much insulin because it's not needed at that point. Some examples of this kind of drug: acarbose, known by the trade name Precose; miglitol, sold under the trade name Glycet. The other type of oral antidiabetic drug, sodium glucose cotransporter 2 inhibitor antidiabetic drugs. These are also known as SGLT. And these work because they inhibit the substance from transporting both sodium and glucose from the renal tubules back into the blood as urine is being formed. So when this happens, blood glucose levels decrease as glucose is excreted in urine. And some examples of this type of drug would include canagliflozin, sold under the trade name Invokana, and the drug dapagliflozin, sold under the trade name Farxiga. Another class of oral antidiabetic drugs are the biguanides, and these act by decreasing the absorption of glucose from the intestines. They also act by suppressing the release of the stored glucose from the liver. They also improve the ability of cells to use the pancreas-produced insulin. Now, there's an added benefit to this class of drug. They do not stimulate the pancreas to produce any more insulin, so the patient is not at risk for developing hypoglycemia. And this is the drug of choice for pairing with a combination oral antidiabetic drugs. A good example of this would be metformin, also known as glucophage or glucophage XR. See, another class of antidiabetic drugs are the DPP-4 inhibitor drugs. And these act because these will prolong the action of hormones that normally stimulate the beta cells to produce more insulin, such as GLP-1 and GIP. And those stand for glucagon-like peptide 1 gastric inhibitory polypeptide. An example of this kind of drug would be sitagliptin, which is sold under the trade name Januvia. Just like we've seen with other types of medications, it's very common to see combination drugs here for oral antidiabetics. And these can contain various combinations, such as a biguanide, such as metformin. It may include a thiazolidine-dadione drug, such as pioglitazone or rosiglitazone, or it may include a type of meglitinide, such as repaglinide. It could also include an example of a sulfonylurea, such as glimepiride, or glyburide, or glipizide, or it could also include a DPP-4 inhibitor, such as sitagliptin. Some examples of common combination oral antidiabetic drugs: Acto plus Met, a combination of metformin and pioglitazone; Avandimet, a combination of metformin and rosiglitazone; Glucovance, a combination of metformin and glyburide; Janimet, a combination of metformin and sitagliptin; and Gentadueto, which is a combination of metformin linagliptin. See some other examples of combination oral antidiabetic drugs: Cazano, which is a combination of metformin and alogliptin; Combiglize XR, combination of metformin and saxagliptin; Metaglip, combination of metformin and glipizide; Prandimet, combination of metformin and repaglinide. All right, now we'll talk about some other antidiabetic drugs. Now, the therapeutic effects of these will differ from insulin or oral drugs. And these are used to treat type 2 diabetes mellitus and sometimes type 1. Some of these are given subcutaneously and others are given orally. Now, these will have various effects on the body. They can stimulate the release of insulin from the pancreas only when blood glucose levels are high. They can decrease the appetite. They can slow the emptying of the food from the stomach. Or they may act by suppressing the release of stored glucose from the liver. Another type of antidiabetic drugs, incretin mimetics, and these are based on the action of incretins. And these are a group of substances that stimulate the beta cells of the pancreas to produce insulin, but only when the blood glucose levels are high. And these are used to treat type 2 diabetes. And this is given by a subcutaneous injection. An example of this kind of drug would be exenatide, sold under the trade name Byetta. Another class of amylin analog drugs. These are based on the actions of amylin. This is secreted from the beta cells of the pancreas at the same time as insulin. And amylins will slow the rate of which food leaves the stomach. And it also acts to suppress the release of stored glucose from the liver. And these also work on the brain to decrease appetite. So these are useful in treating both type 1 and type 2 diabetes. An example of this kind of drug would be pramlintide, which is sold under the trade name Symbolin. The other type of antidiabetic drugs are the bile acid sequestrant drugs. These are commonly used to treat elevated levels of cholesterol in the blood. These have also been approved to help improve blood glucose control in patients that have type 2 diabetes. And this type of drug would be given orally. An example of this kind of drug would be colesevelam, which is sold under the trade name Welchol. Alright, now we'll move into drugs that are used to treat diseases of the thyroid gland. And some common conditions regarding the thyroid gland would be hypothyroidism and hyperthyroidism. In hypothyroidism, there's too little thyroid hormone that's being secreted. And the opposite of that would be true for hyperthyroidism, where there's too much thyroid hormone being secreted. Alright, we're talking about drugs that would treat hypothyroidism. The thyroid gland secretes hormones that are known as T3 and T4. T3, the full name is triiodothyronine, and T4 is thyroxine. And these are collectively known as thyroid hormone, but they are chemically a little bit different. That's why it's T4 and T3. And decreased levels of these can lead to hypothyroidism. One type of drug that a patient could take to treat hypothyroidism are drug supplements, are drugs that will supplement the existing levels of their T3 or T4. These are obtained naturally from desiccated animal thyroid glands, or those that are manufactured synthetically. Now, the drugs that are used to treat hypothyroidism can either contain only T3 or only T4 or both of them. Drugs that only contain T3, an example of that would be liothyronine, that's sold under the trade names Triostat and Cytomel. Drugs that would only contain T4, levothyroxine, that's sold under the names Levothyroid and Synthroid. And drugs that contain both T3 and T4 would include desiccated thyroid, sold under the name Armour Thyroid, and Leotrix, which is sold under the brand name Thyrolar. Drugs that would treat hyperthyroidism. This condition is also called thyrotoxicosis, and it's due to the increased levels of T3 and T4. And the drugs that would be used to treat this condition inhibit the production of T3 and T4 within the thyroid. Some examples of is radioactive sodium iodine 131. This is used to treat hyperthyroidism and also thyroid cancer. And the way this works is a low-level radiation gets emitted from the drug, and it destroys both the hyperactive benign thyroid tumors and the cancerous thyroid tissue. Some other drugs that could be given for hyperthyroidism: iodine, sold under the name ThyroShield; methimazole, sold under the name Tapazole; propylthiouracil, and also sodium iodine 131, which is sold under the trade name Iodotope. Alright, now we'll talk about drugs that are used to treat diseases of the pituitary gland. See, one of the hormones that is secreted by the pituitary gland is growth hormone. This is secreted by the anterior lobe of the pituitary gland. And this will stimulate the production of insulin-like growth factor 1. Children with failure to grow can have an abnormality in any of these areas. It could be a decreased amount of growth hormone. It could be antibodies that are against growth hormone. There could be abnormalities of the growth hormone receptors within their cells, or a decreased amount of insulin-like factor 1. If too much growth hormone is produced, then you get a condition called acromegaly. This causes not only extreme height, but you also get a widening and enlargement of the facial features, in particular the brow and the nose, the enlargement of the hands and the feet. The drugs that would treat this condition work to decrease the production of growth hormone. And this works by blocking growth hormone by the anterior pituitary gland, or blocking growth hormone from activating receptors on individual cells. Some examples of drugs that would treat acromegaly: bromocriptine, sold under the trade name Parladel; lenriotide, sold under the name Somatoline Depot; octreotide, sold under the name Sandostatin; pegvisomant, sold under the name Somavert. There's a need for actually replacing growth hormone. There are growth hormone replacement drugs that are available. And some examples of this category of drugs would be mecasermin, sold under the names Iplex or Increlex; Sermorelin, also known by the name Garef; somatrim, also known by the name protropin, somatropin, also known by the names hemotrope or neutropin. Another condition of the pituitary gland is diabetes insipidus. Now this is having insufficient levels of antidiuretic hormone or ADH. And some common symptoms of this condition are having excessive amounts of urine and excessive amounts of very dilute urine, and also having a high level of thirst. And the drugs that are given to treat this condition act as a replacement for the hormone ADH. And some examples of this would be desmopressin, sold under the names Stymate or DDAVP, or vasopressin, sold under the name Pitressin. Now we'll talk about drugs that are used to treat dysfunction of the adrenal glands. The one condition that can arise from adrenal gland dysfunction is Cushing syndrome. This is where you have too much adrenal gland hormone being secreted, and it's usually caused by a tumor on the adrenal gland cortex. This causes a increased amount of cortisol being produced, which over time can become very serious. And the preferred option for treatment is having the tumor removed surgically. Now, drugs that are used to help treat Cushing syndrome actually suppress cortisol secretion in patients who cannot have surgery. An example of this kind of drug would be pasireotide, also known by the name Synthroid. Another condition of the adrenal glands is Addison's disease. This is an autoimmune condition in which the body's own antibodies will destroy the adrenal cortex. You also will have too little adrenal gland hormone that's being secreted. This will lead to chronic fatigue and weight loss. And when there's too little adrenal gland hormone being secreted, this will decrease your ability to tolerate stress, disease, surgery, for example. And a very common symptom of people who have Addison's is having a unusually bronzed color to the skin. So not a tan, but more of a bronzed look to them. Some drugs that could be used to treat Addison's disease include cortisone, fludrocortisone, also known by the trade name Florinef, and hydrocortisone, also known by the name Cortef. Alright, now we'll talk about corticosteroid drugs. Now the adrenal cortex is what will secrete glucocorticoid hormones. An example of this is cortisol, which has a very powerful anti-inflammatory effect. Now these drugs act like the natural hormones that are secreted by the adrenal cortex, and their chemical structure is that of a steroid. So that's why you have the name corticosteroid, because it comes from the cortex and is a steroid in structure. And these drugs are used as a replacement therapy to treat Addison's disease. These are always given in a tapered dose. These can be given either by mouth or an injection to treat inflammatory reactions in various parts of the body. And these can be used to treat systemic inflammation that's caused by autoimmune diseases such as MS or lupus or rheumatoid arthritis, and so on. Some examples of corticosteroid drugs: betamethasone, also known by its trade name Celestone, cortisone, dexamethasone, also known as Decadron, fludrocortisone, Florinef, like we mentioned earlier, and hydrocortisone, also known as Cortef or Solu-Cortef. Some other examples of corticosteroids: methylprednisolone, also known by the trade names Medrol or Solumedrol, prednisolone, also known by the names Prelone or Pediapred, prednisone, known by the names Deltasone or Metacortin, and also triamcinolone, also known by the names Kenalog or Aristocort. Right, patients who take a prolonged or a high dose of corticosteroid drugs like prednisone develop a unique appearance that is just like the appearance of patients who would have a hypersecretion of glucocorticoids, such as Cushing syndrome. Now, these patients have an increased deposit of fat within the face, often called having a moon face, and also have an increased deposit of fat within the back of the neck, so it looks like they have a buffalo hump. They can also have a thinning of facial connective tissue, which allows the blood vessels to show through, giving their cheeks a bright red appearance to them. These patients can also have increased blood glucose levels. They can also have a wasting of the muscles of their extremities and weakness from having depressed protein synthesis. Alright, this image we have an example of a package of prednisone. As you can see, it is given a tapered dose. Day 1, there are 6 pills. Day 2, 5. Day 3, there's 4. Next day is 3, then 2, then 1. This has to be tapered in this way. There are topical versions of corticosteroid drugs, and these are used to treat inflammations of the skin and the ears, nose, and eyes. Right now we have a quick historical note. A researcher at the Mayo Clinic was attempting to identify hormones in the adrenal gland, and he found 5 substances that he named substance A, B, C, D, and E. Now, to obtain just 2 ounces of substance E, he had to grind 300,000 pounds of animal adrenal glands. Now, in 1941, the U.S. received an intelligence report that Germany was giving adrenal gland extract to its pilots to enable them to fly at higher altitudes. Now, even though the report was false, it stimulated financial backing for adrenal gland research. And then later, substance E became known as cortisone. All right, now we'll talk about drugs that are used to treat diseases of the testes. The main hormone of the testes would be testosterone, and this is the most abundant and most biologically active of the male sex hormones. And testosterone is also known as an androgen because it promotes the development of secondary sex characteristics. Androgen drugs are used to treat hyposecretion of testosterone caused by any number of conditions such as orchitis, delayed puberty, or cryptorchidism. And cryptorchidism is a reference to either one or both of the testes failing to descend completely. Orchitis is an inflammation of a testis. Now, androgen drugs are also used to treat diseases of hyposecretion of testosterone, also caused by chemotherapy, alcoholism, or even surgical removal of the testes. And some examples of an androgen drug would be fluoxymesterone, also known by the trade name Androxy, methyltestosterone, also known by the names Android or Testrid or Virilon, and testosterone, sold under the brand names Androgel or Axiron. Right now we'll mention a quick drug alert when it comes to these drugs. The topical drug testosterone, sold under the name Axiron, is only applied to the armpits. Now the instructions advise the patient to do the following things to avoid transferring the drug to another person. Of course, wash your hands after applying the drug, put on clothing right away to cover up the underarm area. Alright, now we'll talk about anabolic steroid drugs. Now these kinds of drugs change the natural balance between anabolism and catabolism. Anabolism is where tissues are being built up, and catabolism is when tissue is being broken down. Now, anabolic steroids are prescribed for AIDS patients to help counteract the loss of muscle mass and the loss of strength that often occurs with the AIDS wasting syndrome. This is also prescribed to promote weight gain following an extensive surgery or trauma. So anabolic steroids can also be prescribed to increase the red blood cell count and to treat anemia. And they can also be used to increase muscle mass in patients with muscular dystrophy. Some examples of anabolic steroids: oxandrolone, also known by the name oxandrin. This is used to treat bone pain in patients who have osteoporosis. It's also used to treat a lack of growth in patients who have Turner syndrome. Another drug would be oxymethylone, also known by the name Androl 50. Now we'll talk about a drug controversy when it comes to this kind of drug. So although the use of anabolic steroid drugs to increase muscle mass and strength and endurance is illegal in amateur and professional sports, their use still continues. Now the use of 2 or more anabolic steroids at the same time is referred to as stacking. Now often a dose that's taken is 10 to 100 times the dose that would be written for the prescription use of the drug. The continued use of anabolic steroids can cause very pronounced side effects, including decreased sperm count, shrunken testicles, baldness, and also an irreversible breast enlargement in men. In women, these drugs can cause baldness and an excessive growth of facial hair. Now, the serious side effects of anabolic steroid drugs include a very aggressive behavior, also known as roid rage, atherosclerosis, and even liver cancer. All right, that brings us to the end of chapter number 14. We will continue our video series on pharmacology for health professionals with our next video on chapter number 15, neurologic drugs.